Good
Good morning
morning.
and welcome to Rita Sanders, legislative candidate from District 45. Thank you, Rita, for joining us for our virtual legislative candidate meetings this morning. My name is Gina Ragland with AARP Nebraska, and joining me today is Susan DeCamp, Bob Lassen, and Danny DeLong, all AARP lead advocacy volunteers. AARP State President Dave Holmquist is also joining us, as well as Emily Wick from the state office. Rita, we appreciate your taking the time to meet and discuss issues of importance to the 50-plus voter and their families in Nebraska. As a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. So Rita, if you want to start us off by giving us a little background about yourself and your campaign, again, aiming for 5 minutes or less, that would be great. And once we've completed your opening, we'll move into the questions. So thank you for joining us, Rita.
Thank you for having me. First and foremost, I am born and raised in Hawaii and chose to make Bellevue, Nebraska my home. I was here for my sister's wedding. She was in the Air Force and fell in love with the place and have decided if I'm going to get married and have children and make a home, this is it. So while Hawaii is paradise, the quality of living, education, and what you can get for your money goes a long ways here in Nebraska, and a lot more conservative as well. So I am a conservative Republican candidate for District 45. The senior business is my business. About 15 years ago, my husband and I purchased a piece of property here right smack in the middle of Bellevue on the corner of Fort Crook and Cornhusker, and started an independent senior living. We now have assisted memory support and commercial property as well to harness the traffic on the outskirts of that area. We've all heard the statement, the baby boomers are coming. They're here. So it was a slow process when we first started our business. And that's actually what got me involved in politics, the piece of property that we were looking at that could make it affordable for us to build something of quality for the retired seniors. Was blighted and substandard, which made it eligible for tax increment finance. And going through that process for approval is what got me involved in politics, educating the mayor, the city council. At that time, there were 10 to understand what tax increment finance is and how it's used appropriately. And it's win-win for the city. So we're now done with our project. It's alive and well. We've got great managers now that run the independent memory support and the assisted living. So I know it very well, or at least I know it from the developer side of how to make that affordable, how to make it something they're proud to live in when they do have to leave their homes. And the city also benefited from us building it, creating 100 jobs, and being able to hire and train and grow our company. So that's what I do for a living. Watching this on the legislative side will be interesting for me. And I think I have some feedback and some ideas and some experiences that go a long ways. I did serve 8 years for the city of Bellevue. I was the mayor. I ran for office and also ran for re-election. So served 2 terms. So that's 8 years. So I come with public perspective. What we hear and what they want is always great. And the pot of money isn't great. It's not a never-ending pot of money. So how do we make best use of that money? I currently work part-time for Congressman Jeff Fortenberry, who brought me on board to represent him at Offutt Air Force Base. And just like any other jobs we have all had, sometimes you add a little bit more than just Offutt Air Force Base. You add flooding to that. You add the city of Bellevue. Sometimes Plattsmouth, and it goes on from there. But I appreciate working for him, and I'm learning a lot on how we can tie both state and federal together. One of the things through this COVID that you might have been affected by is we hear about telemedicine, telehealth, teleeducation, but it only works if you've got broadband. So how do we work together as the state and the federal agencies to put that together and prioritize that? I think it's going to be the way of the future. I think it makes it more affordable. If you can get on and do telemedicine, telecounseling, and be able to interact with people. It sort of saves, when when you see someone like this, you know, it's not touchy-feely yet, but it's a lot closer than just telephone. So I think that's important that we work together to try and prioritize that. And I think I've gone over my 5 minutes, but
Great, Rita, thank you. Great. So we'll now move into the question side of things. And again, we provided you with a set of 3 questions pertaining to the 50 plus in Nebraska, allotting 5 minutes for each of those questions. And our first question this morning will come from our state president, Dave Holmquist, and it addresses helping people stay in their homes and communities. So go ahead, Dave.
Thanks, Gina. Thank you for joining us this morning, Rita. It's a pleasure to meet you. A livable community is one that is safe and secure, has housing that is affordable. In other words, no more than 30% of one's income is spent on housing. It has transportation options that allow individuals to travel by multiple means, and it has a supportive community with features and services for people of all ages, which allow people to remain in their communities as they age. What steps will you take to ensure that all Nebraskans have access to livable communities?
Thank you. I think we've taken some large steps personally towards that. While we are independent, assisted, and memory support, and we're private pay, we have been looking at how we can engage and possibly develop something that is subsidized. But really looking at the business part of that, the numbers just aren't adding up. So I would push for some incentives, some tax credits, but there's got to be something to make the developers want to be able to do that, be able to pay for staff and transportation and food and all those things that that needs to be provided for them. I think we do it very, very well on the private pay side. Our residents are very happy. We have zero COVID, but that's because we've worked together with the residents and directly with the family. And we do that even on the independent side before COVID. You know, how do we make them successful and hopefully keep them healthy and able to socialize, so the chances of assisted living drops for them, right? So the more you can keep them active and healthy, but how do you do that if you need to subsidize? And we're really looking at that. So that is something I think I'll bring to the state of Nebraska is what are the tax credits that can be available? What are the incentives that could be available? And sometimes they're available, but the list is so long and the work is so hard that it takes an attorney and a whole staff to be able to do those documents, do it correctly, and to keep up on top of that paperwork. So how we navigate together, I think I can bring some experience to the table that I know body, mind, and soul, blood, sweat, and tears going through building a business. You know, pay your staff first is important, so they're happy. But how do you do that and keep up with cost of living? So I think that probably ties in. I think there was a question towards the end of reimbursements, and it's not keeping up with the cost of living. So it's something that ties in together.
Thank you.
Mm-hmm.
Thank you, Rita. We'll move on now. Our second question will come from Susan DeCamp, and it's on health, caregiving, and home and community-based care. Go ahead, Susan.
Good morning, Rita. It's nice to have you with us. Rita, caregivers help older persons live independently at home by providing assistance with things such as bathing, dressing, and performing medical and nursing tasks, such as administering medication and wound care. But caregivers often provide these services with little or no training and little or no pay. So with that in mind, I have a two-part question for you. First, would you support helping caregivers with things such as paid leave, respite services, telehealth, and I know you've already talked a little bit about that, and access to education and training? And how would you protect or expand paid services and supports, as well as financial security that allows more seniors to live independently in their homes and communities?
That's a lot of questions. I can take those one at a time, but yes, in our business, we try to keep them in independent living. And I think congregate living can help keep the costs down. when we look at our residents and what they were to pay if they stayed in their home, and as well as home care providers coming into each home. Sometimes when they're in congregate living, you can have one that can visit 10 apartments within the hour, and hopefully save the traveling expense, time, energy, and wearing people out just by traveling. So I think congregate living is the answer if you can keep things affordable. Also, we've proven that we've hired staff, trained staff, and that's exactly what we want to do and provide benefits for them. So again, I think that goes back to providing, whether it's tax credits or some type of voucher system. But I think we need to look at that and to see what's available as far as how can a business be able to afford to pay for that healthcare provider, which is it's essential, but you also don't want to go broke. And so if you raise the rent, that trickles down to the residents again. And so what are the best solutions? And I think the best solutions we need to look at from the state and the federal department. The need is great, but the pot of money isn't. So where do we shift and take those monies from? Or how do we increase that? Or what is the funding source to be able to do that? We want to do that. We want to provide good services. And on the flip side, we want to provide a fair work environment for the healthcare workers and retirement and all those other benefits. I know companies like Home Instead, they're part-time and they're also companions, but they sometimes do a whole lot more than just a companion, and we know that. But the number one thing they do is build a relationship with that senior and trust with that senior to understand what their needs are. So I don't have all the answers for that right now, but certainly want to look at that and keep up with cost of living and how do we provide for a safe environment and good health care.
Okay, great. Thank you very much, Rita.
Thank you, Rita, for your comments on that. And I appreciate very much. Sometimes it's the smallest little thing that can keep someone in their home aging in place at the lowest level. So do appreciate your thoughts on that. Our last question, we're going to shift now to Bob Lassen, and it addresses nursing facility quality. Go ahead, Bob.
Okay. Again, Rita, thanks for being here today. There's an estimated 6,600 Nebraskans that reside in one of Nebraska's 211 nursing homes. By 2040, the University of Nebraska Omaha projects that number will more than double to almost 14,000. Due to a variety of factors, over the past few years, Nebraska has seen an increase in nursing facilities having to close and residents having to relocate. I know your history is primarily in the urban area, but we're seeing most of these closings occur in the rural settings. How will you ensure that Nebraska residents receive quality nursing home care, including ensuring an adequate nursing workforce, education and training, and proper reimbursement?
Yeah, I think those tie in with the other questions as well. Proper reimbursement keeps a place afloat, right? And how do you get that done with the reimbursements? I think do we go back 10 years or more that we've increased those reimbursements? I know it's been a while, and I've had a discussion with the governor about that a few years ago. I work closely, and this sounds a little reaching out there, but I am Filipino. I'm from Hawaii, but my past are Filipino, and there's a large Filipino community here in Nebraska, and a large portion of them are CNAs, and they're in the home health environment and arena, and this is their first choice. America is their first choice to come and work, and because of our immigration rules and laws, we make it difficult. For example, we have a daughter that's married to a Filipino, and their families are split. They wanted to be here. They applied for working visas, but only half the family were allowed to come. But it is still the land of milk and honey and a dream, and so half the family are here. There's a simple solution about bringing the rest of the family here. They're all nurses. They work in hospice and healthcare, and some are in the event planning arena, but they're all about people service. So that was one of the discussions I had with the governor, is human capital, right? We can trade that. We need to work on our immigration rules. That is how my grandparents got to Hawaii, is the state of Hawaii needed more sugar cane workers. So we had an agreement with the Philippines to bring over migrant workers permanently from the Philippines. My grandparents met in Hawaii. They got married. They had 12 children, but they both came on that workforce agreement. And let's look at that again. We need to look at many aspects of this. You know, there is a pot of money to pay for that. How do we make it affordable? How do we provide? Again, the baby boomers are coming, is past, and the baby boomers are here now, or like some people would like to call it, the silver tsunami, and helping them understand how do you keep your cost of living down. And, you know, one of the answers, of course, that's why I'm in the business, is congregate living. Let's get them in a place where there's affordable housing, where there is socialization, nutritional meals. I think if you get them into an environment where they socialize, they do eat better, they take care of themselves better, they get up in the morning, they shower, they brush their teeth, and it's just a healthier environment. But again, this goes back to, how do you make it available for the owners or the developers to be able to do that affordable? And that goes back to, let's look at some tax credits, or some vouchers, or some type of reimbursement, and be able to keep up with, you know, a big portion of it is staff. Whether you're cooking staff, whether you're housekeeping staff, or your nursing staff, or companion staff, and that's really important. So I think, I don't know if I've answered that question, but I think it's a good question. We will have to muddle through that, and I am willing to roll up my sleeves and work on that. I do think I come to the table with some true experiences. You know, I think if we really target the seniors to get into congregate living earlier, it's hard for them to leave their homes. Everyone has to leave their home. But when you look at, they can save money on groceries by not just cooking for themselves. We buy it in bulk, and what we can do to keep their costs down overall, we can provide transportation for them when you're in congregate living. Take them to their home or their health provider, whether it's a hospital or whether it's a doctor's office, or if they come in to provide services for them. But getting them in there earlier, so they're not there at the door when they've tapped out all of their funds. I think that's an education, maybe a marketing piece that we can work on together. But a lot of times that question doesn't come in mind for them unless there has been a serious issue, whether it's a health issue, whether it's a mental issue, mental health issue, or it's a finance issue. Then all of a sudden they're at your door. You know, I can't afford this, but, and so if we can get that education piece out a lot sooner, I'll work on that together. I do not have all the answers, but I think it's important that we work together and we have all facets looking at that, and how do we do that, make it affordable. And I think the state of Nebraska can set that model in place. And so we'd like to be part of that. I know when COVID hit, our management team right away took on, how do we create the policies for COVID that weren't in place yet? And that was something we worked together with the staff, family, and the residents together to make that successful. So, but we'll work on how do we raise reimbursement, and you know, that's an important piece right now for all of you. I think is how we have not kept up with that. And if I'm elected, hopefully I am elected, I'll look back at the history of that and how do we get so far down the road that we didn't keep up with it.
Good.
Perfect. Thank you, Rita. As we're now coming to the end of our meeting, that's a conclusion of our questions. I'd like to offer you the final minutes to offer any closing thoughts or comments that you have, or any messages you want to send to your constituency. So the floor is back to you, Rita.
I think I work really hard. Well, I know I work really hard. I think I know the senior business very well. And I have done for our community. I've been proven to be able to provide for the community. And also as an elected official, I've stepped up and proven that I can run a race, I can win, and I can continue to provide for the community and understand and listen to what's going on. And that's an important piece, I think, is listening to all sides. When I was in another interview meeting, they brought up, we've seen on accountability disclosure, you've taken money from X, Y, and Z. And I said, absolutely. It's about building relationships. It's about a campaign right now. And one thing I can assure you is I will bring everyone to the table. If it's a senior issue, it's a reimbursement issue. My job is connecting, building relationships, and let's bring that all to the table. I think I do that very well. And what is the end result? How do we get there? And that means crossing the lines politically as well. And in the end, it's providing the best quality for our aging population, our seniors and our families.
Great. Thank you again, Rita, for taking the time to visit with us. We wish you the best with your campaign. And thank you again, most importantly, for meeting with AARP Nebraska today.
Thank you. 28 days and we're all over, we hope. Thank you. Have a great day.
Thanks, Rita.
Thank
Bye.
you.